Cardiomyopathy is a condition of the heart, and more specifically of the heart muscle, which is usually caused by genetic change, but environmental factors, external factors, can also play a role. People are not usually born with a cardiomyopathy, but they may inherit a predisposition from their parents. There might be a family history of the same cardiomyopathy. So they may have a risk to develop the cardiomyopathy later in life. There are different types of cardiomyopathies. Some of them cause a thick heart, others cause a thin heart, a weak heart, and sometimes they're associated with a lot of symptoms, and occasionally they're also associated with risks of complications. There are conditions which in general progress over the time, and they may get worse, but not necessarily. Sometimes they can stay the same in a very mild and subtle form, and patients can be asymptomatic. Cardiomyopathies can cause a variety of symptoms. They can manifest themselves with chest pain, breathlessness, palpitations, which is the feeling of a racing heart. They sometimes cause fainting or near fainting episodes. Most of the time, the symptoms are on exertion. So when patients are engaging in physical activities, but occasionally the symptoms can also occur at rest. The symptoms may change from time to time. They may change from period to period, and the patients may record their symptoms and register their symptoms depending on what activities they're doing at the time. There is a long list of tests to investigate a heart when cardiomyopathy is suspected, but not all of them are required for every patient. We usually start the investigations from a simple ECG, which is the recording of the electricity of the heart at rest. We usually look at the heart with scans, and the most commonly used scans are the echocardiogram and the cardiac MRI. And then we can move on to monitoring of the rhythm with the monitors that are attached to the patient's chest for a period of time, for a day or two, or we can try other types of tests, for example, provocation tests such as exercise tests and other maneuvers to provoke changes inside the heart and record them. In general, we are guided by the patient's symptoms, the patient's presentation, the patient's family history, and of course, the first tests and the results of the first tests will determine the next set of tests, so we don't usually do all the tests at once. Many patients with cardiomyopathy can have a normal life. Not all of them have debilitating symptoms, and quite a few of them can live a normal life either without any particular medical intervention or after they receive some medication or procedures requested and planned by their doctors. Important is that the changes of their symptoms and their adaptation to life is discussed with the doctor, because there might be certain activities which increase the risk of symptoms and the risk of complications in some patients, depending on the cardiomyopathy, on the underlying heart condition. And there might be other activities which are safer for some patients. So it's always important to individualize the counseling and the discussion about the lifestyle the patient should have. But this doesn't rule out a life which is near normal and engagement in all normal activities, including jobs, social life, sports, and so on. There are a number of treatment options for patients with cardiomyopathies, which range from medication to interventions and surgical operations. The type of treatment needs to be adjusted and individualized depending on the patient's presentation. Sometimes a period of monitoring before any treatment is applied is required, so that the doctor knows very well what the patient's symptoms are and what the patient's symptoms are likely to respond to. But eventually, some of these patients will need to undergo certain procedures. Nowadays, a good number of patients will have treatment which will be efficient and will allow them to continue their lives as normal or as near to this as possible.